Hello, just going to talk a little bit about some common myths with regards to breastfeeding. The first one that I hear from most people is that they're not going to have enough milk. And often that is paired with my mum didn't have enough milk, my aunts didn't have enough milk, my sister didn't have enough milk. Somebody's other experience that is telling them that it might be something in their family. So 95% of women will have enough milk. And the only reason they wouldn't is some biological reason that their body couldn't make enough milk. So all those people that have told you that they didn't have enough milk, or if you've already had a breastfeeding journey and you felt that you didn't have enough milk, is because something has been done or there's been a practice that has disencouraged milk production. That could be mixing with formula. It could be not feeding at night and letting your partner feed. Express milk, because at night time is when your body is told by the baby what kind of milk they want for the next day and what the production is going to be like. It may be because some people will sort of do a formula feed thing where they'll say, well, they fed for 15 minutes, I think that's enough. And so they are not getting a fatty enough milk, which comes at the end of a feed. So there's lots and lots of different practices. Sometimes they're really small things that we're doing that actually have a massive impact on our milk supply. So no matter who around you, or even if you in the past felt that your milk started to dry up, or you felt that your baby fed far too much and that must mean they were still hungry, then those things have stopped the supply. Something I will say is that often breastfed babies feed a lot more than a formula fed baby. And if we still have formula feeding in our head and how that works, it's going to be really, really difficult to then understand the journey of a breastfed baby. Breastfed babies often feed in clusters where they'll have a couple of feeds quite close together. Breast milk is also digested almost instantaneously, so they will be satisfied, but they're not necessarily full up because that milk is being digested so quickly. So that's why they can feed again quickly afterwards. Breastfed babies feed for comfort. They feed when they're poorly. They feed when they want to tell your breast that they need a different kind of milk tomorrow. They're starting to grow and they need more fat in their milk. There's so many different things that a baby is doing and telling our breast, and we need to be able to let them come to the breast as often as they want to do that. And that can be really difficult, especially if you've already formula fed or your family members are formula fed, because they will perceive that as you've not got enough milk because the baby isn't satisfied and isn't falling asleep straight after a feed. Another myth is that it's going to hurt. And I really believed that for a long time with my babies 3 and 4. I just fed through the pain. And it wasn't until I did my breastfeeding training and then had my last 2 babies out of my 6 that I realised that it didn't have to hurt. And that's really important. Okay, so I've got my fake breast here. When a latch is correct, the nipple will be going towards the back of the mouth. You see the yellow nipple there? And so the gums will actually be on the top of the areola and around the bottom here. The gums will be massaging the breast, but the nipple should be right at the back of the baby's mouth. and it's protected. When a baby's latch is too shallow, it's massaging your nipple, and that's when you get cracking and bleeding and soreness. And so if the latch is correct, and that's why I say to mums, if it hurts, unlatch the baby and try again. You will get to a point where it should be comfortable, and that's why I think lessons are so important before you have your baby. Some women do get discomfort from letdown, and that is when and it's not always straight away in the feed. Sometimes it's just into the feed, because your breast normally has a little bit of the milk in the breast, and then your breast starts making it as the baby's feeding. So some women find that their letdown is a bit uncomfortable, but there shouldn't be what I would call pain, like where you're clenching your teeth and counting to 10. Please make this be over. That shouldn't be part of your breastfeeding journey. So the other myth I wanted to talk to you today was, my husband says he won't be able to, or my partner won't be able to bond with my baby because I'm breastfeeding and I'm with the baby all the time. And I really want to express so that they can feed and have that bonding. And I would say that in the beginning, expressing can affect the amount of milk that you're making. The no expression machine, your hand, whatever you're using, facilitates the milk as much as a baby does. So in my opinion, I wouldn't do expressing for at least the first 6 weeks of breastfeeding. I know that some people are not in a position to be able to do that because they have to go to work before that in other countries. Fortunately, in the UK, you normally have at least 3 to 6 months maternity. So something that I personally have seen very bonding for family members and partners is to have skin to skin. Have that baby against your naked chest, with them naked and just a blanket over them. Or if they don't feel comfortable with that, just baby laid on their chest. And the baby will listen to the heartbeat, listen to the sounds of the body, just like they did when they were in the womb. And it's very comforting to them and very bonding for both involved. And often that's a beautiful time for you to go and have a shower, maybe go and do a few chores that you want to do, but to keep you as the main milk provider for those first 6 weeks to really help get your flow going. Okay, I will talk to you soon.